I'm Dr. John and today I'm going to show you what is the most commonly misdiagnosed disease in America today. Wilson disease, Whipple disease, Lyme disease, Parkinson's disease and then Willebrands disease. Wilson disease is a genetic disease that leads to the impairment of copper transport. The disease is most often overlooked in a patient who presents with the psychiatric, neurological manifestations of this abnormality. They can present with cognitive impairments, gait abnormalities, tremors, drooling, inability to speak clearly, and a weird facial expression that looks like they are grinning. Unless a clinician does an eye exam and misses the characteristic brownish-yellow ring about the cornea, Kayser-Fleischer Ring, he may miss the diagnosis. Whipple disease is caused by bacteria, T. whippleii. It causes chronic diarrhea, malabsorption, and the resulting weight loss. The problems grow over time, causing joint pain, dementia and problems with inflammation of the heart. Since it doesn't produce a fever, clinicians do not always look for an infectious agent. Lyme disease is a tick-borne illness that is caused by a bacteria Spirochaete burgdorferi. Even though over the last few decades clinicians have been better at diagnosing the acute manifestation of this disease, if it has been missed during its initial presentation or poorly treated, the continuing consequences of this infection can be easily missed. Late sequelae of this infection can cause arthritis, especially in the knee, a subtle chronic inflammation of the brain, or a kind of nerve pain called polyneuropathy. Since these sequelae can appear months to a few years after the initial infection, they can be easy to misdiagnose. Parkinson's disease is a disease of the brain where cells responsible for the production of the chemical messenger dopamine break down and die. The chief features of Parkinson's disease is tremor, slow movement, and rigidity. But the early stage of the disease is very difficult to diagnose without good physician observation skills. Von Willebrands disease is another inherited disorder. This one a defect in the clotting mechanism. Unlike the obvious presentation of patients with hemophilia, only 1% of patients with this abnormality, which causes a deficiency in the adhesive bridge between platelets, the blood component that seals bleeding holes, and the site of injury, have any symptoms. So in many patients that have easy bruising or skin bleeding, this condition is overlooked. Thank you for watching. For more videos, subscribe.